How's it going, guys? Dr. Henry here, your Camas area chiropractor, and today we're going to work on foam rolling out the hip triangle. So first things first, I got to let you know what the hip triangle is, at least what I refer to as the hip triangle. And it starts kind of at this bony part of your pelvis, this really high up part, and the bottom part of the triangle goes all the way down into the ball and socket of the hip. And the reason why I am giving this a name and actually valuing this spot is because a lot of the muscles that control where your knee is in space hang out there. And in a lot of my patients that are trying to be active and have pain, whether they're running or they're squatting or they're walking up and down stairs, this is an area that I often find is tight and weak, and they can benefit from doing some foam rolling. All right, guys, so we're going to work on rolling out this hip triangle. And an interesting little hack for you is instead of using kind of the middle of the foam roller, we're only going to use this edge right here. And the reason for that is because if we're trying to roll out the front of the hip here, I'll show you. So if we're trying to roll out the front of the hip and I really want to rotate over, if I'm in the middle of the foam roller, that guy might get blocked. I might get blocked by it. But if I'm on the edge here, I can actually really rotate far and kind of work that front area. So I'm going to go ahead and just kind of go from front all the way to the back and kind of about this pace. And I'm pushing about a little bit of force in there. I'm not trying to push all my body weight into it. And if I find a spot that is a little bit tender, I've got a couple options. I can kind of hang out there and put a little bit more weight into it, wait for the guy to relax a little bit, or I can just kind of oscillate back and forth. There's no right or wrong way to do it. Another variable you could modify to make this a little bit more interesting is just taking this foam roller and changing the angle on it and going back over that area. You might notice that just that simple little movement makes things a little bit different. You might get into some areas that you couldn't in the first place. So give this guy a shot, and let me know if you have any questions.